So you just got back from the drugstore and you have a big bottle of pills called Escitalopram and you have absolutely no idea what to do with them. That's okay, we've all been there. My name is Isaac Wade. I'm a doctor of pharmacy student at U of T, and today we're going to be talking about Escitalopram in a little bit more detail. So first of all, I'm going to be telling you guys about how it works in terms of its mechanism of action. Then we'll be talking about the safety profile of this medication. Then we'll be talking about the efficacy profile, so how effective is this medication? And lastly, I'll be providing you guys with some of my own thoughts about Escitalopram. So if you're someone who just got prescribed Escitalopram, I encourage you to watch this video all the way to the end. I think you'll learn something interesting about the medication that you're going to start taking. Full disclosure, I'm not being paid by any drug companies to make this video. The information that I express in this video comes purely from the scientific literature and my own clinical experiences and my own personal opinions. This video is definitely not medical advice. It's intended for informational purposes only. Always talk to your healthcare provider before making any changes to your medication regimen. So let's get into the video. Escitalopram, this is a type of antidepressant molecule. It's called a serotonin selective reuptake inhibitor. And I know that word is absolutely a mouthful. Pretty much, serotonin is a molecule in your brain that your neurons use to talk to one another. Serotonin is also implicated in a whole bunch of different bodily functions, including how you feel. When your neurons are talking to each other, sometimes a molecule of serotonin will be shot out of one neuron, but it'll never cross that synaptic cleft and get to the second neuron. What'll happen is it'll actually get reabsorbed back into the first neuron. So what an SSRI does is it prevents that from happening. So serotonin is unable to be reabsorbed back into the first neuron. Therefore, there's more serotonin floating around in that synaptic cleft, and it becomes much easier for that serotonin to make its way to that second neuron, and it's going to be easier for those two neurons to talk to each other. So that's pretty much how an SSRI works. Most people are going to find that taking an SSRI and improving the way that their neurons can communicate with serotonin is going to make them feel happier and more at ease over time. Who is Escitalopram for? Who's going to benefit most from this medication? Generally speaking, Escitalopram is for adults with depression, anxiety, or obsessive compulsive disorder. However, Escitalopram might also be prescribed for eating disorders, post-traumatic stress disorders, and different menstrual disorders as well. Escitalopram is mostly going to be for adults if you're someone who's less than 18, or if you're pregnant or breastfeeding, or if you have other types of conditions or you're taking other medications. Always talk to your healthcare provider to see what kind of risk to benefit ratio Escitalopram is going to have in your particular situation. Like any other drug, Escitalopram has the potential to cause side effects. However, compared to a lot of other drugs, Escitalopram is pretty well tolerated, and the types of side effects that people experience are generally pretty mild, and they tend to go away over time or upon discontinuation. That being said, some of the most common side effects that were noted in randomized control trials included, dizziness, drowsiness, nausea, diarrhea, insomnia, sweating, dry mouth, and sexual dysfunction. And then, like other serotonin selective reuptake inhibitors, Escitalopram does have the potential to cause some weight gain over time as well. So let's talk about frequently asked questions, because I always get asked a whole bunch of questions about this molecule. So one of the biggest questions that I get asked is Escitalopram addictive? Is this going to make me hooked on the medication like something like, like a cigarette or an opioid or a benzodiazepine would? No, Escitalopram is not addictive. However, it does have the potential to cause a pretty uncomfortable discontinuation syndrome if you decide to quit the medication cold turkey. Some symptoms that you get from discontinuing the medication this way might include insomnia, agitation, flu-like symptoms, electric zaps, and a whole bunch of other really uncomfortable symptoms. Fortunately, the discontinuation syndrome is usually transient and it'll go away within a couple days to a couple weeks. To avoid the discontinuation syndrome, I always tell my patients to taper off the medication slowly. For example, you take a half dose once a day for 1 or 2 weeks, then take a quarter dose once a day for 1 or 2 weeks before discontinuing. Never stop your medication without tapering off first. Another common, frequently asked question I get about escitalopram has to do with intoxication. Is this drug going to make me feel intoxicated like alcohol or marijuana would? No, escitalopram will not make you feel intoxicated, or it has a very low probability of making you feel intoxicated. However, like other psychotropic medications, it's always good to be really cautious when you first start taking it. I would recommend avoiding driving, operating heavy machinery, or doing other dangerous tasks until you have a great feel of how escitalopram is going to affect you. It's also not going to be a great idea to combine escitalopram with potentially intoxicating agents like marijuana or alcohol. Doing so might increase your chances of having further sedation and intoxication. The next question I often get asked is it possible to overdose on escitalopram? And that's a very important concern, to be honest, given the type of conditions we're trying to treat here. So fortunately, it's very difficult to overdose on escitalopram. First of all, overdosing is always very, very serious, and you should definitely seek medical attention if you overdose on any drug. But for serotonin selective reuptake inhibitors, it's generally going to be harder to overdose on them compared to other classes of antidepressants. For example, in the literature, we've had individuals take all the way up to 800 milligrams of escitalopram in a single dose. This is 40 times the maximum dose of escitalopram that people take, and they did not have any serious side effects with a dose as great as 800 milligrams. That being said, there have been fatalities reported. However, these fatalities generally included other drugs on top of escitalopram, so it's difficult to know if it was the escitalopram that did the damage. Another question that I commonly get asked is, how long do I have to take this medication for? Am I going to have to take escitalopram for the rest of my life? So this is also a really, really great question. First of all, if you respond to escitalopram, that's fantastic. But after you respond to escitalopram, after your depression or your anxiety or whichever symptoms you're trying to treat have subsided, the goal of your healthcare practitioner is to prevent a relapse. And to prevent a relapse most effectively, it's generally going to be required that you take escitalopram for between 6 months to 2 years after you achieve remission. Now, this is going to vary depending on the individual, and always talk to your healthcare provider about how long you should be taking escitalopram before you're allowed to discontinue, to make sure that you don't have a relapse, or at least to lower the probability that you'll have a relapse. In terms of more serious side effects, one very, very rare but very serious side effect is increased suicidal ideation. And this is something that is more common in those who are younger, for example, teenagers and people in their early 20s. And it tends to go away over time. It tends to be worse during the first couple weeks of therapy. And then as you get used to the medication, then it goes away. But this is definitely a concern. I did read a review article recently. I think it was like a meta-analysis. It did show an increased chance of suicide in youth who were exposed to SSRI antidepressants. And for that reason, for my patients who are in their teens or early 20s, I always recommend that they have someone that they can trust, who knows that they're starting an SSRI antidepressant and who knows about the potential increased risk of suicide, and they have this individual monitor them while they're taking their SSRI antidepressant. Other very serious side effects that are more rare include gastrointestinal bleeds like ulcers, increased risk of QT prolongation, which is a very serious type of cardiovascular side effect, and then also increased risk of serotonin syndrome, which is essentially a very, very dangerous condition that is essentially a serotonin overdose. The risks of experiencing these more serious side effects tend to be very low. However, if you are mixing drugs that interact with each other, the risks of having these more serious side effects can increase. So that is a pretty nice segue into common drug-drug interactions. So let's talk about that now. First interaction that I want to talk to you guys about is with escitalopram and common over-the-counter anti-inflammatory drugs. I'm talking about Advil here, I'm talking about Aleve here, I'm talking about aspirin here, and the risk here is that taking these drugs in combination will increase your risk of having a GI bleed potentially, or a gastrointestinal bleed. If you're feeling pain, if you're having a headache and you're currently taking escitalopram, it would be a good idea to try a Tylenol out first before reaching for an anti-inflammatory like aspirin. Tylenol is generally going to be safer. And then taking escitalopram with other drugs that also work on serotonin, like triptans, which are for migraines, opioids, and amphetamines. Taking these drugs together may increase your risk of having a serotonin syndrome. And then lastly, taking escitalopram with drugs that impact your heart such as certain antibiotics, antipsychotics, and anti-nausea drugs, and a couple other drugs as well. But I don't want to get into these giant lists for you guys. But taking these drugs in combination may increase your risk of having the QT prolongation, which again, very, very serious, potentially fatal drug-drug interaction. All right, so I hope I haven't scared you guys off with the side effects just yet, because we're going to get right into efficacy now. So how well does escitalopram work? So when it comes to treating depression, there are three very well-designed randomized placebo-controlled trials that demonstrated statistically significant reductions in measures of depression in the escitalopram group compared to the placebo group, and this is after an 8-week period. When it comes to anxiety, we pretty much saw the same thing. We had three randomized control trials over an 8-week period, and they found that individuals who were given the escitalopram had lower scores on the anxiety measures compared to individuals who were given the placebo. Lastly, with obsessive compulsive disorder, there was one 12-week randomized control trial that found the same thing, right? People given escitalopram had lower scores of obsessive compulsive disorder compared to people given a placebo. But I want to tell you guys a couple interesting things about these studies. First of all, the placebo effect in all these studies was very, very big, to the point where the difference between baseline and placebo was actually much higher than the difference between placebo and treatment. So although the treatments were clearly better than placebo, they weren't that much better than placebo, and people could potentially derive a lot of benefit from taking placebos. Unfortunately, it's not exactly ethical to prescribe a placebo, but if you're someone who is into, magic crystals or aromatherapy, now might be a good time to pull out your crystals and start doing some magic, right? Because you might actually get a lot of benefits from the magic crystals. The next thing I want to point out is that they also did these longer term studies where they assessed how well escitalopram worked at preventing people from relapsing, and they found that escitalopram did have significant benefits in terms of that as well. Individuals who took escitalopram had a much lower chance of having a relapse compared to individuals who were taking a placebo. And lastly, I also want to point out that a lot of these efficacy measures are dose dependent, which means that individuals that took the higher dose of escitalopram, in this case it was 20 milligrams compared to 10 milligrams, these individuals experienced improvements in efficacy more so than those who were taking the lower dose. In terms of administration, you want to take escitalopram once a day. Generally speaking, it's good to take it at the same time every day. If you experience nausea with escitalopram, you can take it with food. That often helps. If it's something that is preventing you from sleeping, take it in the morning. On the other hand, if it's something that's making you drowsy, you should try taking it at nighttime. That's going to help. When you start to take escitalopram, you want to taper the dose up. You don't want to start at the highest dose. You want to maybe start at 5 milligrams, then go to 10 milligrams, and go to 20 milligrams over a couple weeks. What that's going to do, it's going to reduce your chances of experiencing some side effects. And then lastly, if you do plan on discontinuing escitalopram, always make sure to taper off the medication. This is going to help to reduce your chances of experiencing a discontinuation syndrome. So that's all I have to talk about today. I just wanted to conclude this video by maybe offering some of my thoughts about escitalopram. In my opinion, escitalopram is a very safe and effective medication for the conditions that we talked about. And for a lot of people, the benefits of taking escitalopram is going to outweigh the risks. The placebo effect was demonstrated to be very, very strong in these types of studies. As most antidepressant studies, the placebo effect is always pretty big, which is something to keep in mind. If you're someone who is into, natural therapies, as long as you're making sure that these therapies aren't dangerous, you could potentially derive a lot of benefits from a natural therapy with not very much evidence to support it. The next thing I would say about this medication is that mental health, just as important as regular health, right? Untreated mental health might lead to very severe and irreversible side effects. Big epidemiological studies always find that individuals with untreated mental health problems tend to do worse in a whole bunch of different health categories as well. And lastly, I would say escitalopram might not be effective for everyone, but it's definitely worth a shot. And if you've talked to your healthcare provider and you're thinking about starting an SSRI and you guys have decided that it would be appropriate for you to start an SSRI, Escitalopram would definitely be up there. I definitely would feel comfortable recommending escitalopram as a medication. So I hope you guys found this video informative. I hope you learned something new. And this was a very long form video. I understand it's probably very boring for a lot of people. And I'm just trying to find the right line between having good, high quality information and not trying to bore people to death. So if you guys have any suggestions about how to make this video more watchable, feel free to let me know in the comment section below. Thank you guys again for watching, and I'll see you in the next video.